Hello, I'm Dr. Lorenz, and thank you for joining me today. As we update the status of the coronavirus in our community and our state, it's important to remember the different variables and how they relate to each other. We're doing more testing now than we did 3 months ago, and we're seeing more cases of coronavirus. That is true. But what does that really mean? It may be more helpful for us to look at the positivity rate, as this number better reflects how accurately we can determine the level of spread of the virus in our community. Last week, the positivity rate in Arizona was 33%. That means that for every 3 people tested, 1 person was positive for SARS coronavirus 2. As of July 15th, the positivity rate was 24.7%. the highest positivity rate in the continental United States. This indicates that we may be focusing our testing too much on only the sickest patients and missing too many of the pre-symptomatic and asymptomatic patients with coronavirus. This limits our ability to accurately assess the spread of the virus in Arizona. The World Health Organization recommends a positivity rate of less than or equal to 5% to accurately assess the level of coronavirus in a community. The high positivity rate and the consistently high numbers of new cases that we are seeing each day lead us to believe that the virus is more pervasive in our community than our current testing numbers alone would indicate. And when we add this information to the fact that our healthcare system is being utilized at maximum capacity and our death rate has remained at record levels for weeks, our situation continues to be dire. Dr. Robert Redfield, the director of the CDC, stated this week that the upcoming fall and winter will be the most difficult time we have ever experienced in American public health. As we try to create a return to school plan for our children, our teachers, and our school workers, this can make us feel quite out of control. So what do we do? What can we do? There continues to be an overload of information coming at us from news feeds, social media, and in our interactions with our family and friends. The importance of managing this information and making the best decisions for yourself and your family is greater now than ever before. It's estimated that the average adult makes 10,000 to 40,000 decisions per day. Our goal continues to be to make the best decisions we can as frequently as we can. We've spoken about this in the past with regard to the many choices that we make during the day, which contribute to our health and our wellness, and the same principles apply here. At the end of my talk today, I'll read a piece which nicely lists those things in our lives that we have control over. I'll also list them in writing in the email today as well. I hope you'll refer to it frequently and perhaps print it out and refer to it daily, as I think it'll be especially helpful. As we progress through these next few months, we may intermittently feel out of control, and it will help to remember those things that we truly have absolute control over. It's also important to remember again to choose those 1 or 2 news sources. Choose them well. Check in with them once or twice a day, and then turn them off. You will be kept sufficiently up to date with that practice, and it will go a long way to preventing overwhelm. Feeling out of control usually occurs when we're needing to make a decision about something. First, let's talk about decision-making in general. It's important to consider a few things when trying to make the best decisions for yourself and your family. You might ask, what do I want the outcome of my decision to be? If I choose A, what are the possible benefits? What are the risks? Do the benefits outweigh the risks? In identifying the risks, you can avoid making poor decisions out of familiarity. We can grow accustomed to bad habits and not consider the dangers involved. Every time you go to a gathering and remain uninfected with coronavirus, you might become more comfortable with that decision, despite jeopardizing your safety. Conversely, consciously creating healthy daily habits and making them automatic and routine can contribute plenty to your health and your safety. It's important to align your decisions with your core values and your priorities, as there will be more emotional energy behind those choices, and the follow-through will be more spontaneous. It can be very helpful to ask input from others, but be careful not to get involved with others' opinions about what's best for you. Especially during this coronavirus pandemic, your situation may be unique and only you can make decisions for yourself. Beware of taking shortcuts with your decision making, especially when we have so many decisions to make. It's normal for our minds to create mental shortcuts called heuristics that help us make decisions more quickly. Availability heuristics means making decisions based on information that most immediately comes to mind. So you watch a lot of news feeds, and you might make decisions on events or situations that you hear most televised, and not on what is most relevant to your situation. The coronavirus situation in Arizona is quite different than in other states, and your personal home situation may be more complex than other households in our community. You may care for an elderly parent, or you may have a close friend or relative with chronic illness or undergoing chemotherapy. And this would require a different decision for you than for your neighbor. Acknowledge the biased or inaccurate assumptions you may have about people or events, and you will be able to make more objective decisions. Take note of possible overconfidence, as that can make your judgment go awry. Emotions can contribute positively to your energy and commitment to follow through with your decisions, or they can create fear and confusion, leaving you numbed or incapacitated. I think word choice is extremely important here. It allows powerful support of your decision making and avoids confusing your decision with exaggerated fear and uncertainty. Saying, "I'm feeling afraid or confused right now," is quite different from saying, "I'm a mess," or "I will never be able to make the right decision." Talk to yourself as you would a valued friend. Ask yourself, what would I say to a friend who had this decision to make? What wisdom would I contribute? This reduces the emotional load, allows a kinder internal dialogue, and helps you to be more objective and confident in your decisions. Set aside time to reassess and acknowledge your missteps and less optimal choices. This enables you to make appropriate changes, and a better outcome can result. As we know, there are few absolutes with this coronavirus pandemic, and the data and facts do frequently shift. There will therefore be very few perfect decisions. We need to collect the current facts, collect the information, relate them to our personal situation, and make the best possible choices. As we look at decision making during COVID-19, it's helpful to consider a few specific questions. First, how much coronavirus is in our community? A lot. As we discussed previously, our best estimate is a lot when we look at the positivity rate, the hospitalizations, and the deaths in Arizona. The larger numbers do come from Maricopa County, but Pima County hospital systems are as full and strained as theirs, and our efforts to avoid the spread of the coronavirus in our community continues to be paramount. Second, what is my risk of exposure to COVID-19? Remember, your chance of contact with coronavirus is related to the concentration of the virus, the length of time of exposure to the virus, and the distance from the source of the virus. Professional organizations are now working on identifying how these factors interact with air circulation, air temperature, humidity, surface materials, and aerosol properties. They will someday quantify for us exposure risks. But in the meantime, we have to protect ourselves those proven, tried and true behaviors of physical distancing, hand washing, hand sanitizers, avoiding touching public surfaces, cleaning surfaces at home and at the office regularly, and avoiding touching your face. Third question you might ask is, what can I do if I'm exposed? Direct exposure to COVID-19 creates 3 challenges: not getting ill, not causing others to become ill, and not experiencing severe illness or death. First, all of those above mentioned practices can still protect you if you've been exposed. If you are exposed by touching a contaminated surface and you avoid touching your face and you use hand sanitizer or wash your hands relatively soon, you can avoid getting COVID-19, period. It's critical to wear a face mask whenever you're in public for this very reason. It protects others if you have been unknowingly exposed and are pre-symptomatic or asymptomatic. And it also is important to quarantine yourself and call me if you think you've been exposed. Avoiding severe illness or death involves practices which optimize your general health and promote a robust immune system, as well as access to good health care. I can help you with all of these. To be sure, we've learned a lot about this new coronavirus, and progress continues to be made. The phase 1 trial of the Moderna messenger RNA vaccine had a promising outcome, with all of the 15 patients who received the final planned dosage of the vaccine developing antibody levels similar to those patients who had the illness. Phase 2 trials continue, and phase 3 trials are due to begin next week. This trial will include 30,000 patients receiving the vaccine. And there also continues to be progress with therapeutics, which shorten hospitalization by a few days, especially with those moderately ill patients who require hospitalization and oxygen but do not require ventilators. Dr. Anthony Fauci predicted this week that effective herd immunity may be possible in 18 months. It will require a vaccine to be 70 to 75% effective and administered to at least 2/3 of our population. So there are reasons to be hopeful. And we know that it is helpful on many levels to focus on that hope and on things that are good in your life. Holding an optimistic attitude, maintaining thoughtful determination to care for yourself and those you love, remaining physically active, being creative, connecting with others regularly, and focusing on what is really important to you. Improve your mental health, your physical health, and help you to make those best decisions. In closing, let's remember those things in our lives which we have full control over. Your beliefs, your attitude, your thoughts, your perspective, how honest you are, who your friends are, what books you read, how often you exercise, the type of food you eat, how many risks you take, how kind you are to others, how you interpret situations, how kind you are to yourself, how often you say, I love you, how often you say, thank you, how you express your feelings, whether or not you ask for help, how often you practice gratitude, how many times you smile today, the amount of effort you put forth, how you spend or invest your money, how much time you spend worrying, how often you think about your past, whether or not you judge other people, whether or not you try again after a setback, how much you appreciate the things you have. Remind yourself of these often, and perhaps spend some time each day contemplating them, as they are the important things. Again, I send you blessings of health, safety, beauty, and joy. Thank you so much for being with me today. Bye-bye.